Welcome, everybody. My name is Tony Maritato. I'm a licensed physical therapist, and on the show today is Dr. Scott Albright. So Dr. Albright is a sports medicine physician. He's an MD. He's a non-surgical orthopedic specialist, and I am going to have him just give us a couple minutes of background because we've had Dr. Albright on the show before, and he brings such a unique perspective to answering questions about pain and functional limitation and disability that, being an orthopedic specialist, he understands the body better than anyone, but not being a surgeon, he has a different perspective than most. So Dr. Albright, if you would just give us a minute to tell us a little bit about yourself. Where are you from? Where do you work? And then I've got a boatload of questions for you.
All right. Thank you, Tony, for having me. So I'm Scott Albright. I've been at orthopedic practice here in Middletown, Ohio for about 15 years now. And so I do quite an array of different orthopedics. Sports medicine probably is about 10% of my practice, and the remaining is all general orthopedics. So I see pretty much every breadth of everything you can in orthopedics, fractures, soft tissue injuries, and pretty much the gamut.
So I would love to hear from your perspective. I have a large community of individuals that have had total knee replacements. I've got a growing YouTube channel, which we'll be sharing this video on. And really, probably the most frustrating thing for somebody who has undergone a knee replacement, really with the intention of eliminating pain, improving function, getting back to living, the life that they want to live. There's a handful, and some of the statistics out there suggest as much as 20-25% of individuals have a knee replacement and either are not happy with the outcome or are worse off after surgery. I want to talk about that person that's 12 months post-op. They've done everything right. They've followed all of their instructions. They've gone to physical therapy. They've done all the things that they needed to do. But yet they continue to have specifically pain in the knee. Do you ever get referrals from people that are suffering from this kind of condition? Kind of what's been your experience with something like that?
So this is something I actually do see quite often, especially from orthopedic surgeons outside our office, outside our practice, and then patients are just kind of going wherever they can. And usually it ends up on my doorstep. And so this is something I'm very familiar with in terms of dealing with and having, treatments and trying to go through all the different scenarios that it possibly could be in terms of trying to get at the root of the pain.
And how do you kind of brainstorm that? The most common symptoms and complaints that I see is pain in the knee. But then they'll also present with some redness, some swelling, some heat. A lot of times they'll be experiencing like a Baker's cyst behind the knee. What are some of the most common symptoms and frustrations you're seeing for somebody who's 12 months or more post-op?
A lot of those same symptoms. And when I see somebody that's had a total knee, especially with any warmth, redness, swelling, my first indication is it infected?
Right.
Because that usually is kind of one of the main sources of pain that you have to decide whether or not that truly is from an infected total knee. And so if I do see that, my first step is I usually get blood work, see if there's any elevated inflammatory markers. And if there is, then you have to take that next step and actually pulling fluid off. And I do that under ultrasound so I can see exactly where the fluid is with the total joint and send it off for a culture and see if there is an infection. And if it does come back infected, you have the answer, and it has to be revised, antibiotic spacer, and it has to be, a new knee has to be put in.
How do you differentiate, or what are you looking for in a situation where they have those symptoms, the redness, the pain, the swelling, the heat, and we're not quite sure, could it be an infection or could it be a sensitivity? Could it be an allergic reaction? Could it be that the person's immune system is responding to some of the material that was used within the implant?
Regardless of the source, you have to get fluid to send. And if the fluid comes back negative for infection, that's when you start going down the road of, is there some sort of allergy to it. And then there are blood work that we can get that actually looks at some of the components to see if, there is an elevated titer to that would say, yeah, there is a sensitivity to the metal, which then would require a revision to a different type of component.